I think that's Napier, somewhere down there. This is nice. I haven't looked through these photos in years.
Yeah.
Like many other Pasifika at the time, Grace's mother Liz came to New Zealand in the early 1970s for better work opportunities. She worked 3 jobs at one stage to keep the family's house running, a house that now the family will have to sell. Grace's mum was diagnosed with Alzheimer's last year and forced to retire early. She was left without an income. On top of this, she required care 24/7, so was moved into a home in March this year.
She voluntarily put herself into respite care. Sorry. If she hadn't, then I would have had to enforce that, which would have been really hard. But going into respite care, she got this wraparound service around her of professionals. And it's at that moment that I finally accepted that as her daughter, I just couldn't look after her the way she deserved to be looked after.
Grace's mother gifted the house to her children before her illness worsened. They took over paying for it, and on top of this, they had to cover the cost of her care themselves, failing to qualify for a work and income subsidy. It's called the Residential Care Subsidy. They didn't qualify because the equity of the house which was gifted is seen as an asset by the government. According to the criteria, the total value of your assets has to sit below a specific threshold, and Grace's mother's house was worth more.
There's no money exchanged, obviously, and then, that money is held against her name as an asset and an income for the next 4 years.
The cost of care, around $4,900 a month, is putting a strain on the family's resources.
Mum being Samoan, the weight of expectation you feel as a child of that parent, as a Pacific person, is I've got to take care of Mum or of my parent all by myself. And it's really hard to let outside support and services come in. I was born and raised in this home. Yeah, so was my son. Yeah, Mum's first home that she bought with my father at the time. So, yeah, we've had this home for over 40 years. When you have dementia, places where you feel safe are very limited, and this home was that only place for my mum.
It's a case that Dementia New Zealand say people need to be better prepared for should they find themselves in a similar situation.
We've certainly been exposed to a number of cases like this. Unfortunately, the number of people with dementia in New Zealand is set to increase dramatically over the next 30 years. We think that this probably warrants a review of the asset levels. We think that the asset levels are really quite low. We have a number of people saying to us, I just didn't know that dementia was going to be that expensive.
We asked the Ministry of Social Development about Grace's case and if there's any other assistance available to her. They responded,
"We remain committed to doing everything we can to support Ms. Taylor. We may be able to assist her with one-off essential costs that she may be unable to meet."
And the Ministry of Health says the criteria is meant to treat everyone receiving care fairly, but the government has no plans to change the way income and asset testing is used. However difficult her situation, Grace's circumstances have spurred her into action.
I will be doing a public petition because it's the legislation that needs to be changed. Just making it more available for people to get the support that they actually really deserve and need.